Yeah, that's a great question. I mean, I think anytime you're implementing a new change that's going to require multiple levels of care, right, it's going to involve nursing, residents. We're a hospital that has trainees. It takes time, and so this undertaking did involve several educational sessions for all levels of staff. And it was a process. I mean, we're really grateful for our informatics team because we decided to use an iPad-based questionnaire. There's a lot of ways that you can screen. You can just have the nurse ask the questions, but privacy was really important to us for this. We really wanted patients to feel like they could answer the questions safely. And so using something where they could fill it out privately was a major priority. So it took months. It took months for our informatics department to develop the tool. Once it was developed, I would say it was pretty straightforward and it did go pretty seamlessly. Of course, we had to test it out a lot and make sure, okay, the patient's actually entering it in. Is it entering, populating correctly in the medical record and so on and so forth. So, even in the study, we sort of adjusted for 4 months of just rolling this out. And fixing all the little kinks that kind of came up along the way. I think this is something, I mean, to think about, other institutions as they try to implement similar screening tools. It takes time. I mean, this process was over a few years. If you think about just the meetings on what we wanted to create, how we wanted to devise the tool, what were the current tools that we were going to be basing our screening tool off of. It took a lot of time. And then once we had written it all on sort of paper, we had to convert that to an electronic form. So it was a process, and there's still work to be done. I mean, we still want to kind of see how many patients are not even filling it out, how many are refusing it. There's still a lot of work to be done in terms of the follow-up period. But it was a great undertaking with a really positive result. So we're happy we did it. Fortunately, we weren't able to study that specifically with the tools that we had. Our hope is that, yes, we're removing again, coming back to the privacy piece, someone sort of asking you those questions. A lot of times, patients are coming in for labor. They're with their families, and yes, ideally, when you're asking these sensitive questions, you're having the family members step out and so on and so forth. But we know from a practical standpoint, that's not always possible. So the hope is that we do plan in sort of some of our follow-up evaluation for this tool to assess what patients thought about the tool, what how it made them feel. Was it something that they felt comfortable filling out? And I think when we look at our refusals, that's also going to highlight that a little bit. I mean, initially when we rolled it out, we did do some chart auditing to just see that it was being completed most of the time, and over 98% of the time it was being completed. But it's been, it's been many, many months, actually, probably years by now. So the enthusiasm when something is first rolled out can sometimes change over time. So it's going to be really informative when we assess those things.